Robert and his wife and 4 children moved to Juneau 7 years ago from Kansas City. So I would imagine Robert's had some good barbecue in his day. I'll have to ask him about that. Robert holds degrees from the University of Missouri, Columbia, and William Jewell College. So Robert, I'm very happy to have you here today. I'm looking forward to what you have to tell us and report on the status of everything pandemic related. So there you go, Robert, it's all yours.
Thank you so much, Eric. It is great to be here today. Thanks for the invite again. I'm going to go ahead and share my screen. I have a couple of slides to share. And primarily what I'm going to be talking about is vaccines today. So let me see if I can get the right screen shared.
And Robert, I just want to remind you real quickly, you probably do need to speak up just a little bit so everybody can hear you really well, okay?
Copy that. I will do my best. Let me know if it gets to be too quiet. So the first thing I want to mention is that probably most people on the call today know that we are hosting a mass vaccination clinic this weekend, Friday, Saturday, and Sunday. We filled up on Monday when we released those appointments. In the first 25 minutes, 1,100 appointments were filled. We are expecting some cancellations and no-shows. That's just natural when you have 1,100 people sign up for something, that not everyone will be able to make it for a wide variety of reasons. And so just today at noon, 9 minutes ago, we released this form on our website to allow people to sign up for a waiting list. We announced this yesterday, and so I wouldn't find it remiss if anyone wanted to divide their attention just briefly and sign up. We're asking for people who are interested, who are eligible. So you have to be over the age of 65 or a healthcare worker who hasn't already been vaccinated. And we're only asking for people who have the ability to show up to Centennial Hall within 20 minutes of getting a phone call from us on Friday, Saturday, or Sunday. And the reason why we're doing this is because we want to make sure that we don't waste any vaccine. I'll talk a little bit about thawing vials and what that means later. And we also, just as important, want to make sure that we don't miss any vaccine opportunities. It's really our goal to get vaccines into people's arms as soon as we get it and not have it sitting in freezers. So you can do that. If that's you on the call today, you can do that at juneau.org/vaccine, and we'll only have this form up for long enough to get enough interested people, because we don't want to give anyone false hope either. So just until we have enough so that we can be assured that we won't waste any vaccine or vaccine opportunity. So I wanted to start with that since it's kind of time sensitive. So a little bit about the clinics this weekend. So the clinics that we're hosting are a work of our Emergency Operations Center, and our Emergency Operations Center is a partnership, a collaboration between the City and Borough of Juneau, Bartlett Regional Hospital, the Division of Public Health at the state, as well as many healthcare volunteers. We have been overwhelmed and grateful for the number of healthcare volunteers, retired healthcare professionals, nurses and doctors and other staff that have reached out to us and volunteered to help us put on this clinic. It's really been phenomenal. So we're really grateful and thankful for that. As I mentioned, we have 1,100 doses of the Pfizer vaccine that we'll be administering this weekend. That represents a full tray of the Pfizer vaccine. One question that we get is, that it's been in the news that those Pfizer vials often have an extra dose in them, and we've accounted for that in that 1,100 number. We're getting a full tray that normally is stated by the manufacturer to contain 975 doses. But we know many of those vials have a 6th and sometimes 7th dose in them. And so that's where we got that 1,100 number. And those appointments for that clinic went live on Monday, and we filled up within the first 25 minutes. And I haven't heard of another mass vaccination clinic in the state of Alaska filling up quite that quickly. So I think it's safe to say that people in Juneau, at least those who are eligible for this particular phase, we're really chomping at the bit to get a vaccine, which is good. And we're definitely, it's our intent to host more of these clinics just as soon as we get more vaccine. An interesting statistic that I wanted to share is that according to the State Department of Labor, we have about 4,500 residents who are age 65 or older in Juneau. And so, that gives you a sense of the magnitude. We're reaching just shy of maybe a quarter of those with the number of vaccines that we have for this weekend. And also, according to the Department of Labor, when you back out those folks who aren't eligible for either of these vaccines, and that's anyone 15 years old and younger, we have about a total number of 26,000 eligible residents for these two vaccines in Juneau. So that's right now, that's our target number. Although of course we know not everyone will choose to receive a vaccine, but that's what we have as a target number. And we're at, so far, as of yesterday, we're at about 1,800 doses delivered. And of course that number will jump by 1,100 by the end of the day Sunday, so we'll be at 2,900. So 2,900 out of 26,000, that's over 10% of our eligible population will be vaccinated by the end of the weekend. So we are well on our way, although we do have a long way to go. So another question that I'm getting quite a bit of is, what's the bottleneck? So, what is it going to take? What do we need to do to speed up the process to get more vaccine in arms? In Juneau, the bottleneck is the vaccine itself. It's not the ability to administer it. So we have a healthy medical capacity in Juneau between our pharmacies, our medical practices, the hospital, our public health staff. We have we have all of those facilities, and then we also have the capacity to put on these rapid POD, is what they're called, clinics. POD stands for point of dispensing, these mass vaccination events whenever we get a big supply of vaccine at once. So we really do have the ability to push this out. When we have lower amounts of supply, like when vaccine is just trickling in instead of flooding in, those pharmacies, our doctor's offices, our medical practices, they themselves have the ability to get that vaccine out on a regular sort of day-to-day basis. So I thought it would be good to give you a sense of timing of how all this kind of pans out, or how it has panned out so far. So for the doses that we're going to be administering this weekend, we got a final confirmation that we were actually definitely going to receive them on Thursday evening of last week. So once that happened, we made plans on Friday to announce that those signups would be available on the following Monday at noon. We wanted to make sure we had at least a weekend to let the information to disseminate, to give everyone kind of a fair shot, an opportunity to get themselves signed up if they were eligible. You don't really want to announce that signups are available and then open them up an hour later, because there's just too many folks who aren't going to know about it in that case, and a lot of people would feel fairly and rightly kind of blindsided in that scenario. So we wanted the weekend to push the information out. Those signups went live Monday at noon. They filled up super quick. And then the vaccine itself arrived ahead of schedule, which was great. We were anticipating getting it on Wednesday, yesterday. Instead, it arrived on Monday. So it's been in the freezer at the hospital since then, and we will have it out of the freezer and into people's arms starting on Friday. So that's a very, very quick turnaround. That's what we want to see. And we are definitely communicating that here in Juneau, we have the ability and the capacity to get that vaccine out quickly. So if anyone's out there with extra vaccine that needs it out of freezers and into arms, they can send it to us and we will make that happen. And so also to kind of give you a sense of scale, so over the weekend, we'll be operating for 3 days for 4 hours each day at 1,100 doses total. It'll take about 30 people working each of those 4-hour shifts. And in the scenario, if we received a lot more than 1,100 doses than one tray of Pfizer, it would be pretty straightforward for us to work 8-hour shifts or 12-hour shifts instead of 4-hour shifts. So we do have the capacity to sprint and do more doses in the future if we end up with more vaccine. And in the scenario, again, where it just kind of trickles in instead of floods in, that's where we'll be looking at our pharmacies and our medical professionals and practices and clinics to administer it and keep it flowing out of freezers and into arms. So another common question that we get is who's eligible when? Who's eligible now? Who's coming up? When are they going to be eligible? So this slide comes from the State of Alaska Division or Department of Health and Social Services COVID vaccination website. And I didn't put the actual URL in here, but it's an easy one to remember. It's covidvax.alaska.gov, and vax is VAX, like vaccine. And so you can find all of these details here, and you can click through to the links and get the definitions. But essentially, eligibility for vaccination is being broken up into phases and tiers. Each phase has a number of tiers within it. And then once you get through all the tiers, you move into the next phase. Those phases and tiers are being defined by the Alaska Vaccine Allocation Advisory Committee, which is a mouthful, AVAC for short. And that committee is composed of 23 professionals, medical professionals from across the state that represent kind of a diversity of the medical profession. And what they do is they start by reviewing recommendations from the Advisory Committee on Immunization Practices, or the ACIP, and that's a body that is, it's a body of the CDC, it's a federal level body, and they kind of set the high level direction, the high level guidance on who's eligible when, based on how much vaccine is coming out of the manufacturing process, and based on the risk to certain individuals, the potential risk for harm, based on kind of the ethics of who should be vaccinated when, and what priorities should look like. So they kind of set those high level guidelines, and then AVAC here in Alaska makes some specific recommendations to DHSS, Department of Health and Social Services leadership. And then so far, DHSS leadership has simply been adopting AVAC's recommendations, although they could adopt them in part if they wanted to, or they could adjust them if that made sense to them. And then vaccine providers like us, and like our pharmacies in town and our medical practices and clinics, they agree to follow those recommendations from DHSS leadership when distributing the vaccine that the state provides. There are other vaccine channels that I might get some questions about that I could talk about during the Q&A too, but for the vaccine that the state provides, it follows those AVAC recommendations. So we are in phase one, or we've been in phase 1A for a little bit now, and you can think of that as the healthcare worker phase. And just recently here, last week, we entered phase 1B tier 1, which is not on the slide. So that's kind of where we're at now. And that's individuals who are over the age of 60, who are 65 and older. So a really common question that I get is, okay, so when are we going to be through that phase? And the answer is, it really depends on how much vaccine that we get. So, you can get a sense of it. If we have 4,500 seniors in town and we're vaccinating 1,100 of them this weekend or thereabouts, there are still some healthcare workers in there. And some of them are getting vaccinated through pharmacies and clinics. We'll within a week or so maybe be through a third of the people that want it in that age group thereabouts. So the state's been pretty clear that we won't wait until we've gotten entirely through any given tier before we move on to the next one. But I think we will wait until we get most of the way through that tier, and until most of the people in that tier have a vaccine opportunity. So if we get another couple of big batches, it's definitely possible that we could be entering the second tier of phase 1B, perhaps by the middle of February, is an educated guess, and it is frankly just a guess. But tier 2 of phase 1B, once that we enter that will be open to frontline essential workers who are 50 years old and older, as well as people who live or work in congregate settings that haven't already been covered in phase 1A. Tier 3 of phase 1B is a much larger tier than tier 2. So it covers everyone, regardless of their work status or their health condition status, who is between the ages of 55 and 64. So that's going to be a pretty big pool of people. And additionally, then it starts to cover frontline essential workers who have health conditions, high-risk health conditions, as well as people over the age of 16 living in unserved communities. That's tied to water and wastewater systems, and that doesn't apply to Juneau. And then tier 4 of phase 1B covers everyone over the age of 50 who have 2 or more high-risk health conditions, as well as frontline essential workers just in general, who haven't already been covered. There's no age or health attachment to that one. So that's who's next. After phase 1B, there will only be 4 tiers in phase 1B, and after that will come phase 1C, which AVAC will be meeting soon to discuss. But it'll be a while before we're through these next 3 tiers, I would say. So the next thing I have is I want to talk a little bit about this system called PrepMod. PrepMod is and I'm going to go through quickly on this because I want to talk a little bit about how the vaccine works itself too before getting into Q&A. But I thought this would be helpful. PrepMod is the system that the state is using, and frankly that many states are using across the country to get people signed up for vaccination clinics. It is what we're using too for our point of dispensing clinics that we're hosting this weekend. And it is a web-based software solution that helps people, guides people through a process of making appointments. And it's what we used on Monday. It's not a perfect system, but it is getting better, and I think it will get better over time. There was a really rough rollout earlier in January, and it's been improving since then. So when you go to PrepMod, you can search for a vaccination clinic by address within a certain radius or mile range. If you're just interested in a particular vaccine brand, you can search that way too. The search functionality is one of the things that's been challenging about PrepMod because when you search here, you're searching all of the clinics in all of the state of Alaska, and that can be challenging because there are hundreds of them. When we release new clinics in Juneau locally, we are bypassing the search screen by directing people to our website, juneau.org/vaccine, where we're providing direct links to the specific clinics that have availability that we're putting on. That's what we did on Monday. And that takes you directly to the application process for making an appointment. And I'm going to walk through it really quick. It doesn't take much time at all. So this first screen, you fill out your name, some demographic information, date of birth, email address, phone number, and address. None of the clinics that we do will be collecting insurance information. That's one of the things that has been challenging for other clinics. Some places do require insurance information, and when you do that, you have to upload pictures of your insurance card, and that can be challenging. All the clinics that our EOC is hosting are completely free, so we're just asking people to bypass that page. We can't remove it. We've grayed out what we can gray out. There are a number of health questions that are asked, and these are there so that our vaccinators at the clinic can know how long you need to be monitored during the period after you receive a vaccine. It's generally either 15 or 30 minutes, depending on your health characteristics. That's the rest of that page. It's pretty straightforward. There's a consent page where if you have a choice between which vaccine is being provided, you would pick that here. I think it'll be a little bit of time before we start offering choices at our pods. We'll need a lot more vaccine availability before that becomes viable. You either sign your name or you can type your name. And then the last page is picking an appointment. This has been a little bit of a tricky page too, because when you're picking an appointment, if there's only one appointment remaining in any given time slot up over here, if you click on save and continue and someone else was also trying to sign up for that same last appointment too, you might get an error message if the other person clicked save and continue first before you did. We saw that quite a bit on Monday when we had a lot of people trying to sign up for, when the demand was higher than the supply of appointments, if you will. And unfortunately, PrepMod doesn't yet have the functionality where if that error message pops up, it should just let you pick another one, right? That would be the logical thing. Unfortunately, it kicks you back to the beginning. So that is a piece of frustration, and that's very high on our list for the vendor to get resolved. But nevertheless, you pick an appointment, and as long as you weren't competing for that last appointment with someone else, when you click on save and continue, you'll get an email confirmation and you're signed up and off you go. That's it. So that's the appointment process. I hope probably some of you have already experienced that, but for those that haven't, that's what it looks like. And so the last thing I wanted to talk about, I thought this would be interesting, is to talk a little bit about the vaccine itself and how it works. I won't go into a super deep level of detail, but it's really kind of cool and interesting. So this is a depiction of the coronavirus itself. of SARS-CoV-2 is the scientific term. And you can see the characteristic spikes on the outside here. Those are the big red things. And so these spikes, they're a protein, and that's what enables coronavirus to get its whole genetic material into your cell and make you sick and infect your cell and replicate and then go infect other cells and cause symptoms and all that. So what the vaccine does is it pulls out just this small piece of genetic material in the virus that codes for creating these spikes. So it ignores the rest of it. It just pulls out that, and then the vaccine manufacturers came up with this sort of ingenious way of putting that tiny little bit of genetic code, its messenger RNA, inside basically fat bubbles, is what you can think of it as, or like bubbles of butter, and this messenger RNA is put inside these bubbles and then injected. And so, you know, the reason why it has to be inside these bubbles is because messenger RNA is a really unstable substance in our bodies, and it's supposed to be unstable because its only purpose is to communicate messages within cells. And once it's communicated its message, you don't want it sticking around because it doesn't serve a purpose. It's kind of like a sticky note in that, you know, after you've used it, after you've reminded yourself or communicated that message, the sticky note, it just gets shredded or thrown away and off you go. And so you can't just inject the mRNA into your body directly because it'll degrade before it gets inside of a cell and gets read. So that's why the companies that have been manufacturing these vaccines have been working for decades, actually, to come up with this concept of being able to get the messenger RNA that they need into our cells. And it's really this ingenious sort of fat bubble that they've come up with to do that. And so how it works is the vaccine particles. So there's many of these vaccine particles, these little bits of messenger RNA surrounded by these fat bubbles in the vaccination. They get injected into your arm, and then they get into your muscle cells in your arm. That little bit of messenger RNA gets read by the machinery of your cell, and as it's being read, the cell has a bunch of amino acids in it that form a protein that is related to whatever is coded for in that messenger RNA. And the protein, of course, is that spike protein. And then so a lot of that spike protein gets made by those muscle cells in our arms, and then it gets expressed on the outside of the cell. Another really common way to make vaccines is to just make this protein outside of our bodies and then inject the protein, and then our immune system can just see the protein. But that's really hard and really complicated, and it takes really unique and challenging manufacturing processes, and it takes a really long time to do it. That's why vaccine development is often measured in decades rather than years. And so it's pretty ingenious to get our own cells to create it so that it doesn't have to be created outside of our bodies in factories. So anyway, that spike protein gets expressed on the outside of our cells. That allows the immune system to start to respond to recognize it. And then basically it just kickstarts your immune response. So, you know, this is kind of a picture of SARS-CoV-2 inside of the body. And the green things here are antibodies. That's one of the ways the immune system responds to threats to us. And when you just have SARS-CoV-2 introduced without an immune system that already knows how to combat it, is already aware of those spike proteins, your immune system kind of has to start from scratch, right? It has to recognize it. It has to start to build up antibodies and other sorts of immune responses like T cells, and that can take a while. It can take days and weeks, and that in that intervening period, you can get really sick, and that's where we start to see symptoms and all of the sort of bad things associated with COVID-19. And so the flip side of that is if you already have an immune system that can recognize that spike protein, then if you're exposed to the actual coronavirus, then you can kick it quickly, right? So that's the goal of vaccine, and that's that's how it all developed. So that's the last slide I had, Eric. So I don't know, I can't remember, I should remember from last time how we are taking Q&A, but I would be happy to start doing that. Let me stop sharing my screen. There we go.
Okay. Well, that was a bit of a chemistry and biology lesson for everyone. So I'm sure we're all kind of, our brains are kind of, squinted and focused and be like, I think I remember most of that. So hopefully we'll get some questions in here. Let's see. I have one in here. Yeah, John wanted to know if will the CBJ finish the 4,500 seniors before moving to the next phase?
Yeah, that's a great question, John. So I have two thoughts in response to that. So the first one is that we will move to the next phase when AAVAC tells us to. So when the DHSS, guided by the Vaccine Allocation Committee, says, okay, time to move into tier 2, we'll do that. But my second thought is, unlike many areas of the country and unlike some other areas in the state too, it is, I think, less challenging for us because of our healthcare, because of our very strong healthcare sector. It is less challenging for us to administer vaccine. So it's possible, maybe even probable, that we'll find ourselves in a scenario where we are kind of ahead of the game compared to other places in moving to the next tier, right? So we may be closer proportionally. We may have, if the state were to decide that okay, we're moving into tier 2 when 75% of people who want a vaccine opportunity have had one, we may be at, say, 85%. Just some speculation there.
So I have a question. So when you're administering the first dose of this vaccine to everybody, so how are you tracking, and how long can you wait before you get a second dose before the first dose is no good anymore? Does that make sense?
That's a great question. So as I understand it, it's probably, so when you get a vaccine, you likely start to gain some immunity after that first dose. We don't know how much, and we don't know how quickly, but you likely start to gain some protection soon after that first dose. But what we've learned through the phase 3 clinical studies and the efficacy studies that Pfizer and Moderna did is that we know for sure that you get that 95% effectiveness 1 week after your second dose. So that's what we know for sure, and that's what we're counting on. And it differs, when you get your second dose, differs a little bit from vaccine type to vaccine type. So for Pfizer, it's 21 days. For Moderna, it's 28 days. There is a little bit of a grace period there. So I think the guidance is, I should know this off the top of my head, but it's 4 or 5 days, I believe, window on either end of that period. For our clinics that we're running this weekend, we will be scheduling people for their second dose appointments exactly 21 days later while they're in their waiting period. So after you get a vaccine, you need to be observed for either 15 or 30 minutes, depending upon your healthcare status, to make sure you don't have any adverse reactions. And we're taking advantage of that 15 or 30-minute window to get people scheduled for their next one. Yeah.
And are you holding back that second dose? In other words, they get their first dose, so therefore their second dose is already here, or are you just assuming you'll have that second dose in 21 days?
Yeah, we're assuming we'll have it. We are not holding back any doses, and that's at the direction of federal and state levels of government. So we are being assured that those second doses will arrive on time for us to administer them. And that's happened so far during phase 1A for our healthcare workers. We have been getting our second dose shipments on time.
Okay. Maggie's asking if she says she's read that the Pfizer vaccine works against the virus variants. Does Moderna's work against the same variants?
I haven't seen any hard data either way yet. That's not to say that there isn't any hard data out there, but I have heard anecdotally that it is thought that both the Pfizer and the Moderna vaccine work against the known UK variant. the way to think about this, or the way that I've heard people think about this, is it depends on how the virus varies as to whether or not the vaccine will remain effective against it. So we know that both the Pfizer and the Moderna vaccine are just targeting the spike protein. So if the virus is varying in some other way, if it's varying, it has a long genetic code that it can vary anywhere along that strain on that code. And so long as it's not varying the spike protein, then no big deal, right? Because all the vaccine is looking for is that spike protein. If it's varying the spike protein itself, then the question is, well, how much is it varying? And if it varies the spike protein a lot, then the virus, it potentially can mutate itself into oblivion. That's possible. It can mutate itself in a way that it can no longer get into human cells. Or it could potentially also mutate as a spike protein in such a way that makes it look very different, in which case the vaccines may not see it anymore, and we might need a new vaccine. We see that every year with the influenza vaccines. They mutate quite a bit every year, and we have to kind of rediscover how to vaccinate against them. So it can kind of go either way, but as best as we know right now at this time is that the vaccines, the Pfizer and the Moderna vaccines, continue to be effective, but again, no hard data yet.
Okay. Let's see. Someone else is asking, what are the differences between the 2-shot series needing to be kept super cold versus the upcoming single shot not needing the super cold environment?
Yeah, that's a good question too. So the Pfizer vaccine is the one that needs to be kept super, super cold, and the Moderna one doesn't need that deep freezing. It just needs kind of normal freezing. And the reason behind the necessariness or lack thereof of the cold temperatures has to do with how those fat bubbles are chemically constructed that surround the messenger RNA. And Pfizer and Moderna had their own processes for how they went about developing those. They're called lipid nanoparticles for how they went about developing those. And it's just that's how they did it. It ended up needing that ultra cold refrigeration for Pfizer and that just normal cold refrigeration for Moderna. And other companies are learning new things and took a little bit more time perhaps to learn them. To be able to create slightly more stable versions of that. And the upcoming single, there's actually quite a few upcoming vaccines, and I bet they'll probably all be just a little bit different in how they need to be refrigerated or how their shelf stability looks.
And kind of following up on that, is there any updates on when other vaccines in the final approval stages will be available or released for production by the FDA? I understand the Johnson & Johnson vaccine is a single dose option. I think I heard something about that one having some completing its trials later this month or something.
Yeah, I haven't seen the phase 3 clinical data on those yet. I'm eagerly anticipating looking at that. But no, I don't know any backstory on that, unfortunately. I wish I did.
Okay. Here's an interesting question. Once you're vaccinated, will you still need to test at the airport when returning to Juneau?
Yeah, that's a good question. So as of right now, the answer to that question is yes. One of the things that we don't really know yet about the vaccine that we're still waiting to learn is, does it prevent transmission of COVID-19? We know that it's effective at preventing symptoms in us individually once we're vaccinated, but we don't really know yet if it's also effective at preventing you, if you are exposed to the coronavirus, of transmitting it to other people. So for now, the answer to that question is yes. I suspect it will change over time as we learn more about how the vaccine works and how strong of an immunizing effect it has in our bodies. But yeah, stay tuned, I think, is the answer to that one, really.
So is that that question about with the transmissibility and all that, is that something that's just studied as the vaccine is given out and they're actively studying that and we'll know in a few months? Or is that something we won't know for a year or two? How does that work?
You know, my understanding is that question is normally studied as part of the phase 3 clinical trial process, but Pfizer and Moderna omitted that outcome. So they pick outcomes that they want to study for the sake of speed to get the vaccine out quickly. So they only looked at the outcome of, is this effective at preventing symptoms in individuals rather than studying kind of the whole gamut of things that they normally study, and this being one of those. And so, you know, how they would have studied that is they would have been testing people throughout their trial to determine whether or not they were capable of producing for lack of a better word, growable coronavirus as they were once they were immunized. And they're doing those studies now. I don't have a good guess as the timeline as to how long that'll take. I mean, it's going to be measured in probably months, though. I would speculate maybe 6 months, but we don't really know.
So that group of 30,000 people, that was the clinical trials, they're still being studied as this goes.
Oh yeah.
They're still they're following up with them and keeping them under study for however long they're going to do that.
Yeah.
Okay. Let's see. Did I have another one? I thought I had another one. Wait, it's over here. Man, I don't think you know to this answer this one, but how long after vaccination are you considered immune?
Yeah, I don't really know the answer to that. I've heard some speculation. I think the Moderna CEO speculated or said something the other day about how he was thinking that it was looking like it might be good for up to a year, maybe. I think he was speaking optimistically, but we don't really know yet. And same deal with that. So those people that were part of the early trials are still being followed up with and studied to see how long they retain an immune system memory from the vaccine. And that is something that immunologists can look at pretty clearly with blood samples and the like. It's possible to see, you know, what's your antibody level look like? Is it declining? What's the rate of decline? What's your T cell, count look like? Is it declining? What's the rate? They study that pretty closely.
Okay. And Mary's asking, she's asking, would you explain to us the procedure for after the second vaccine? So I'm assuming she means the second shot. And, you know, once you have the second shot, do you just walk out the door and you're done? Or is there some follow-up after that?
There's a waiting period, just like for the first shot. So there's a monitoring. You'll get your second vaccine, and you'll wait with us for, again, 15 or 30 minutes, depending on your medical history, and then off you go. I will say that you know, one of the ways that the vaccine, I mean, the primary way that the vaccine works is that it encourages your body to mount an immune response. And immune responses can make us feel not so great. So it is not atypical to have soreness at the injection site, to feel kind of fatigued and out of it for a day or so, even to get a fever for a day or so is not atypical. And that really just means that it's kind of a misnomer to call it a side effect, because it's really your body doing what it's supposed to do when it receives the vaccine, and that's to start creating those antibodies and those T cells and those memory T cells to be ready to combat the actual coronavirus if you're actually exposed.
Yeah, and this kind of sounds like the same thing with the flu vaccine. When you get the flu vaccine, you might feel a little fatigued that one day. It might have a soreness in your arm. That's pretty standard, common vaccine stuff.
Yeah, it is. And this message, the way that this vaccine works is super interesting too. I mean, there are other vaccine technologies. This messenger RNA technology is brand new. The more common ones are the ones where, as I was saying earlier, where the protein is the spike protein, in this case, is manufactured outside of your body and then injected. Another way is for the virus to be killed or inactivated, the actual virus, and then to be injected into you. That's how, let me remind myself. I think that's how the influenza vaccine works. I think that's an inactivated virus vaccine. And then
vaccine works too.
Say that again.
Isn't that how the polio vaccine works?
I think that is. I'm not sure on polio. Another way that they do it sometimes is by it's called attenuating it. So they make it less threatening. So they maybe allow the virus to keep replicating, but they take out part of its genetic profile that is responsible for the worst symptoms or something like that. And that's how the chickenpox vaccine works. But in this case, the viral, the only part of the genetic code that is being that is part of the vaccine is the part that codes for that spike protein. It's none of the other stuff.
Okay. Let's see. Somebody else is asking, what precautions should people take after being vaccinated? Masks, social distancing, small social circles?
For now, nothing changes on that front. So for now, all of that stuff stays the same until we know more about the potential to transmit once you've been vaccinated. I think, you know, one of two things will happen first. Either we will learn, we will potentially learn that you do not regularly or consistently transmit COVID-19 after being vaccinated, or we'll get to such a high proportion of our population immunized that it won't matter, right? One of those two things will happen, and then that's my best guess at this point as what starts to change those mitigation practices. Although there are other things that could happen too. I think there are potentially just cultural or societal norms that could change too. So anyway, that's kind of what I got on that.
Drew wants to know if there is any value to antigen testing, and if so, is it an option in Juneau?
Antigen testing is viable. So we're actually starting to do some pretty significant antigen testing on school district staff. Antigen testing is the most useful if you can do it regularly on the same person. So if you can do an antigen test twice a week or 3 times a week, it's a pretty good test. The antigen testing is less sensitive than the standard type of test that we use, the PCR test. So PCR tests will detect, if you get exposed to COVID, a PCR test will detect it in, let's just say, I'm going to use round numbers here, in 2 days or so, based on how quickly COVID will replicate in your system and be detectable by a PCR test. Whereas with antigen testing, it may take 3 or 4 days instead of 2. So it takes longer, it's less sensitive. But it is still valuable, again, if you can do it in sort of a surveillance way. It's also valuable if you have a known outbreak situation, especially in a congregate care setting. Then it's really valuable because you can do a lot of antigen tests really quickly and they're really cheap compared to PCR tests. I'm not aware of anywhere that you can get an antigen test in Juneau right now if you're just a general member of the public. They're not being done in a broad sort of way right now. But we are still doing the more sensitive PCR tests for anyone who is experiencing any symptom. And you can get that by calling the hotline at 586-6000. And we just concluded an asymptomatic testing event. We've done 2 of those so far where we were offering those PCR tests just to anyone.
Okay, let's see, we're going to get 2 more in here, I think. Is the vaccine effective if your arm does not get sore or have any adverse reactions?
It's a really good question. That's a question that I was meaning to ask at the last Science Echo that the state puts on. My understanding is yes, it is still effective, but I don't really know enough about the science about that to be able to capably talk about why. But that would be a great question for one of the state Science Echoes that are normally on Wednesdays at noon.
Okay. And for residents returning to Juneau by plane, will the new equipment at Bartlett result in faster turnaround, same day, of a COVID test?
Yeah, hopefully. So that equipment is on site. It is operational. Our staff are trained on how to use it, and we're finishing validation processes right now. We expect it to be online for just all the lion's share of the testing that we do in Juneau as of probably not next week, but the week after, towards the end of the month. Although the question was about traveling, and so sorry, I'm gonna have to backtrack a little bit. The answer about traveling is no. So we're not planning on using that machine for travel-based testing. We're only going to use it for symptomatic tests, and we're basically going to use it for every test that is done in Juneau outside of the airport. So we're getting enough reagent to run about 900 tests a week on that system, which isn't enough to process the airport test. Now that said, the airport contractor is changing hands. So we've been operating the airport testing, screening and testing for some months now. And that contract is changing to Capstone Clinic out of Anchorage as of February 1st. They were awarded that by the state, and they are going to be using a lab in Anchorage called Beechtree to analyze their tests. And Beechtree also has been very quick. So they've been 1 to 2 day turnaround times on their tests. So hopefully, even though we won't be analyzing the airport tests in town like we will the other tests that we do in town, the turnaround time still should be very quick, very quick. One advantage that Capstone and Beechtree have is that they are on Hawaii's NICE list, right? So if you need a test to go to Hawaii, you'll be able to do that through Capstone and Beechtree at the airport once they take over on February 1st.
Okay. Yeah, there's one more question here, but I think we've already answered that one. So, okay. Well, Robert, thank you very much for coming today. I certainly appreciate it. You've given us a lot of great information. We all appreciate all the hard work y'all are doing down there at the EOC, keeping us all safe. And we hope to, hopefully this will all result in the long run in us getting back to a more normal situation down the road.
Absolutely.
So, with that, please remember that you can register for our webinars either through the newsletter or the chamber website. You can also purchase raffle tickets on the site. We do have a new raffle coming up, so watch for that. That'll be something to we'll be pushing in the next few weeks. Next week, would like you to also join us next Thursday. We're very happy to have our presenter will be Dr. Ann Zink from the state. So I'll get some more information. So all those questions that Robert couldn't answer, we will kick up to her and see if she has an answer for us. So thanks for joining us today, and join us next week. Have a great day, be safe, and wear your mask. We are adjourned.